Hi everyone, welcome to Raaonline. I am Dr. E. Mohanapriya, MBBS, MD Anatomy and DNB Anatomy. I am teaching anatomy for the past 10 years. In my lecture, I will help you to understand the concept of the topic and also few mnemonics which will be useful for you to remember the few terminologies throughout your life. So, topic for today's discussion is brachial plexus. This is a plexus of nerve which is going to supply the entire upper limb. In curriculum-based medical education, these are the competencies given in relation to brachial plexus. The first competency is describe formation, relation, branches, area of supply, course and relation of terminal branches of brachial plexus. And the second competency is explain variation in formation of brachial plexus. And the third one is explain the anatomical basis of clinical features of Erb's palsy and Klumpke's paralysis. Let's start the session with a clinical case scenario. A baby with a history of forceps delivery was brought to the pediatrician after 4 weeks for the routine checkup. On examination, it was observed that the baby's left arm was medially rotated and adducted. The left forearm was pronated and extended. Name the position of upper limb seen in this baby. The second question is, lesion at which site of brachial plexus causes this position? And third one is, the paralysis of which muscle results in adduction of arm, and paralysis of which muscle results in extended forearm in this baby. For all this question, come to the answer at the end of the session. So, we'll start the session with what is nerve plexus. This is a combination of fibers from different sources or different spinal segment levels to form new nerves with specific targets to innervate. There are two types of nerve plexus present in our body. On the right side of this picture, it was shown the somatic plexus. On the left side, the visceral plexus are seen. But remember, these two plexus are present on either side of the body. The somatic nerve plexus are mainly formed by ventral rami of spinal nerves. In the cervical region, the cervical plexus is formed by ventral ramus of C1 to C4. The brachial plexus is contributed by C5 to T1. The lumbar plexus is contributed by L1 to L4 ventral ramus, and the sacral plexus is formed by L4 to S4 ventral rami. The coccygeal plexus is formed by S4, S5 and coccygeal nerve 1. Here note, from T2 to T12, these nerves are not participating in any of these plexus. Now, what is ventral ramus of spinal nerve? You know already the peripheral nerve system includes 12 pairs of cranial nerve and 31 pairs of spinal nerves. So, in the 31 pairs of spinal nerve, the cervical nerves are 8 in number, 8 pairs, and thoracic region we have 12 pairs of thoracic spinal nerves, and the lumbar region 5 pairs, and sacral 5 pairs, and coccygeal only 1 pair of spinal nerves. Here you note, in the cervical region we have only 7 cervical vertebrae, but we have 8 pairs of spinal nerve. Now, we will see the course of typical spinal nerve first to understand the concept. This is a cross section of the spinal nerve. Here you can see the head-shaped grey matter in the center, which has anterior horn and posterior horn. From the anterior horn, ventral root cells arises. These rootlet joins to form ventral root. This is also called motor root. From the dorsal horn, we have dorsal root which is coming. In the center, we have the dorsal root ganglion. So, finally, the ventral root and dorsal root joins to form trunk of the spinal nerve, which immediately divides into larger ventral ramus and smaller dorsal ramus. If you trace the ventral ramus on the lateral aspect, it gives lateral cutaneous branch, which in turn divides into ventral branch and dorsal branch. If you trace further, it ends by continuing as anterior cutaneous branch, which in turn divides into medial branch and lateral branch. The dorsal ramus, which goes and divides into medial branch and lateral branch to supply the skin and muscles of the back. If you see in this picture, the ventral ramus is suspending the sympathetic ganglion by 2 roots. These are called, the lateral one is called white rami communicans, the medial one is called grey rami communicans.